Thank you, Omar, for the introduction and opportunity to present at Drug Delivery to the Lungs Conference. So, as you all know, I'll be presenting my work on pulmonary delivery of bedaquiline-loaded cubosomes for non-small cell lung cancer treatment. So, to start with, lung cancer is an invasive and rapidly metastasizing cancer defined by uncontrolled cell growth in lung tissue. Approximately 1 in 5 cancer deaths are attributed to lung cancer. Lung cancer is further classified as small cell lung cancer and non-small cell lung cancer, with latter accounting for majority, that is 85% of the cases. Despite the advancements in cancer therapies, the survival rate of lung cancer patients remain dismal. Hence, there is a need for new drug candidates and drug delivery system. For this purpose, novel drug development can be employed. Novel drug development is expensive and takes 10 to 15 years to hit market. The slow progression, substantial development cost, and high attrition rate of novel drug development makes drug repurposing an attractive avenue. The short development time frame and available preclinical data makes drug repurposing a safer and a high timely return on investment option for new drugs. Bedaquiline is an FDA-approved antibiotic for treatment of pulmonary tuberculosis, and it has recently shown anti-cancer activity in NSCLC cells. Currently, bedaquiline is administered as Eutoro tablets in daily dose regimen for 6 months. However, the low oral bioavailability and low lung levels of the drugs, along with severe adverse side effects, often leads to termination of this treatment. Considering these shortcomings, we propose inhalation delivery of repurposed drug bedaquiline for non-small cell lung cancer treatment, considering that it will present more drug at the cancer site in the lungs. For this purpose, we are using cubosomes as drug delivery systems. Cubosomes are lipid nanocarriers formed by the self-assembly of an amphiphilic molecule in excess of water. Cubosomes have cubic internal structure formed by single lipid bilayer wrapped around two separate water channels as denoted by purple and green stick model. Figure C demonstrates orderly cubic structure of cubosomes after cryo-TM imaging. The particle size of bedaquiline-loaded cubosomes, abbreviated as BQLC, was around 150 nanometers with narrow PDI range of 0.24. The cubosome nanocarriers were cationic with zeta potential of positive 35 millivolts, showed good encapsulation efficiency of 50% and drug loading of 20 micrograms per mg. The morphological examination showed spherical cubosomes with irregular polyangular shape. The BQLC formulation was further freeze dried to perform solid state characterization. As you can see from DSC studies, the drug melting peak of bedaquiline was absent in BQLC thermogram, suggesting that drug was successfully encapsulated in cubosomes matrix. This study was further confirmed by PXRD studies. As you can see in BQLC pattern, the drug characteristic peaks were absent and it only showed the poloxamer characteristic peaks similar to blank cubosomes. This suggests that drug was either molecularly dispersed or in an amorphous form. In vitro aerosolization studies were performed using next generation impactor. Briefly, 2 ml of formulation was nebulized using per-ELC plus cup and run for 4 minutes at 15 liters per minute flow rate. Uh, Stage-wise drug deposition after nebulization is shown in the figure. The prepared BQLC formulation, referred to as undiluted, showed viscosity of 50 centipoise and resulted in a MMRD slightly greater than 5 microns. The prepared BQLC formulation was viscous and showed a greater MMAD. Hence, to investigate the role of viscosity on the aerosolization performance of cubosomes, we investigated the diluted formulation. So the prepared BQLC formulation were further diluted in 1:1 ratio with water, and viscosity was found out to be 25 centipoise. The diluted formulation showed MMAD of 4.2 microns with higher fine particle fraction of around 80%. This validates that increased viscosity increases MMAD and impacts the aerosol deposition for jet nebulizers. However, the emitted dose for both the formulation was around 50%. Since this is the first study focusing on inhalation delivery of cubosome nanocarriers, we performed post nebulization particle stability. As evident from the results, the particle size increased 1.2 fold and zeta potential was reduced, suggesting particle aggregation. This is due to this is due to high frequency of particle contact during aerosol generation by shear forces of jet nebulizers. Further, we performed in vitro cell culture studies using A549 NSCLC cells. Cytotoxicity studies were performed by standard MTT assay. A 52 micromolar IC50 of free bedaquiline was reduced to 17 micromolar using BQLC formulation. A threefold reduction in IC50 of drug can be attributed to the rapid internalization in A549 cells. To verify this, we performed cellular uptake studies using Nile red loaded cubosomes. As you can see in the figure, nuclei was counterstained using DAPI and shown in blue color. Cell membrane was stained with WG and shown in green color. And the merge image shows the accumulation of Nile red loaded cubosomes in vicinity of DNA inside the cell, in vicinity of nuclei inside the cell. Next, we perform apoptosis assay using annexin V, which stains the apoptotic cells in the culture. As evident from the results, the apoptotic cell percent for BQLC treatment was significantly higher as compared to control and BQLC, which suggests that BQLC induces greater apoptosis as compared to BQ in A549 cells. Scratch and clonogenic assay have gained importance as important cell culture assay to evaluate the cancer cell migration and single cell proliferation. For scratch assay, y-axis represent percent wound healing, that is the cell migration versus treatment time on x-axis. As expected, control group showed maximum cell migration, whereas BQLC treatment is significantly inhibited the cell migration. A similar trend was seen in clonogenic assay with BQLC formulation inhibiting the percent growth in colonies. This both studies confirms the efficient inhibition of cancer metastasis and a potential application of BQLC formulation against advanced NSCLC cells. Lastly, we perform 3D spheroid assay. 3D spheroid assay have gained importance as they better mimic in vivo tumor conditions or in vitro in a spheroid plate. The tumors were treated in multiple dose regimen every 3 days until day 12. The untreated group showed five-fold increase in spheroid volume, whereas BQ treatment group showed four-fold increase in volume. As you can see from spheroid growth curve and respective optical imaging, BQLC significantly inhibited cancer tumor growth in vitro, and this study was further confirmed using live dead cell assay. In live dead cell assay, live cells are stained with green dye, whereas dead cells are stained with red dye. The control group showed intensified green dye, suggesting that more viable cells was present in untreated group, while the treatment group showed presence of red dye at the core of spheroid. The red dye was more intensified for BQLC treatment, suggesting that BQLC significantly inhibits tumor growth in multiple dose regimen as compared to BQ. In conclusion, this is the first study focused on inhalation delivery of cubosomes for treatment of non-small cell lung cancer. The prepared BQLC formulation showed optimum particle characteristics, efficient drug entrapment, and suitable aerodynamic properties for inhalation delivery. The positively charged BQLC showed enhanced cytotoxicity in A549 cells, rapid internalization, and inhibition of cancer cell metastasis. The excellent efficacy of BQLC in 3D spheroid model further provide evidence for translation of cubosomes as nanocarrier system and repurposed drug for non-small cell lung cancer treatment. I would like to thank College of Pharmacy, St. John's University for research funding and Dr. Nitesh Kunda, my research advisor, for this opportunity and support throughout this project. Thank you.
Suyash, thank you very much. Very nice story and very nice slides. A lot of work that you've done there. We've got quite a few questions. I think we've got probably time just for 2, maybe 3. But so let me just kick off. So you said that the drug is an anti-tuberculous drug, and you have now utilized it for non-small cell lung cancer. So 2 points. 1, what is the mechanism of the anti-cancer effect? And 2, how do you know that this has a cytotoxic effect on lung cancer cells and doesn't affect healthy cells?
Okay. So the first mechanism of action for bedaquiline in lung cancer cell is by mitochondrial respiration and glycolysis. So it basically inhibits that and results in ATP reduction and oxidative stress in cancer cells. And to answer the second question, uh, we haven't tried bedaquiline on healthy lung cells yet, but that is the next step we are going to administer. However, the cubosomes which we tried and the formulation did not show any effect on the formulation did not show any effect on at least cancer cells. So whatever cytotoxicity we have is by the drug and not by the formulation.
Thank you, Suyash. Michelle, I know you wanted to pick up on something.
Yes, thank you, Omar. So we've had quite a lot of CMC questions coming in. One of them is really taking it back to first principles. Can you tell us a little bit about why you chose cubosomes for your nanoparticle delivery system versus other types of nanoparticles?
Okay, so cubosomes have shown better thermodynamic stability and then high drug loading as well as enhanced cytotoxicity effect for uh, anti-cancer drug as compared to liposomes. And secondly, uh, considering its thermodynamic stability at versus liposomes, we went ahead with cubosomes.
Okay, thank you. And then just moving on from that, I mean, what I think I heard you say was that, you know, cubosomes, you have better drug loading, but also that they have better anti-cancer results versus liposomes. Can you tell us, can you tell us a little bit more about why that would be? You know, what do you know about the safety of the excipients and how acceptable could they be in this oncology situation?
Okay, so the glyceryl monoleate which we used for preparation of uh, cubosomes is not yet approved for inhalation delivery. However, it is used for parenteral. So talking to manufacturers about it, they suggested that it will be still safe for inhalation delivery. However, there is no official statement on that.
Suyash, thanks very much. Ben Alex, we've got 30 seconds for a question. Shall we just go to you?
Yes, can do. I had a question for you. Yeah, thank you for that talk. Have you done any work to look at the ongoing stability of your cubosomes? So you've shown some data that seem to suggest they were amorphous, I think. Have you got any feeling for how stable they are over time?
Okay, so we did the colloidal stability of cubosomes and we found out that cubosomes were stable at 4 degrees Celsius, like refrigerated temperature and room temperature for 2 months. However, the stability of cubosomes could be further increased by making dry powders, which will enhance the stability as compared to the colloidal stability. So we have data of colloidal stability for 2 months, but we haven't done the dry powders yet.
So much, Suyash.